everyone, it's me, Miss Ruiz. I would like to thank everyone for joining me today as we discuss Chapter 5, which is our first big section in the ICD-10 CM. We're going to be coding infectious diseases. That was a tongue twister. Alright, let's get started. So following this chapter, you should be able to interpret the details required to report an accurate code for an infection, clarify the details about bacterial infections, determine the specifics needed to report viral infections. We'll also translate information about parasitic and fungal infections into diagnosis codes. We'll abstract documentation to identify important details about the specific pathogen causing a diagnosis. We will ascertain the correct code or codes to report immunodeficiency conditions. We will apply the guidelines for reporting blood infections, and finally we will analyze the documentation to identify the code or codes required to report antimicrobial resistance. Right, here are some key terms. I do have these on flashcards. So we have acute, asymptomatic, bacteria, chronic, fungi, human immunodeficiency virus, also known as HIV, infection, infectious, inflammation, nosocomial, parasites, pathogen, sepsis, septic shock, septicemia, severe sepsis, systemic inflammatory response syndrome, also known as SIRS, tuberculosis, and viruses. All right, infectious and communicable diseases. So infections happen once a pathogen successfully invades the body and begins to replicate. This may be localized, for example, a toe. It may spread regionally to the whole leg. And sometimes it can become systemic, and that is throughout the entire body. Signs and symptoms of infection: increased body temperature, known as a fever, increased white blood cell count, increased tachycardia or decreased bradycardia in the heart rate, increased hyperventilation or decreased dyspnea in respiratory rate. These are all important to know, because if we do have a viral infection, then these are common signs and symptoms. So that means if we have a diagnosis of what it is exactly causing this, we cannot code the symptoms or the signs. So with a fever, for example, we would not code that if we have one of these codes from this chapter already identifying our diagnosis. Communicable diseases and how they spread. They can spread through touch exposure, so this is physical interaction with blood, bodily fluids, non-intact skin, and mucous membranes. It could be airborne exposure. Some pathogens travel in small particles that remain contagious in the air. Droplet exposure, so dispersed in large droplets such as those transported by coughing, spitting, talking, and sneezing. And then also finally contact exposure. Contact exposure. As with touch exposure, some infections such as herpes simplex virus are communicated by skin-to-skin contact or skin to other surfaces, for example countertops and paper. We can also have them spread through needle sticks and sharp injury exposure. Bloodborne pathogens including HIV, hepatitis B, and hepatitis C can be highly contagious when contaminated needles or other sharp objects, for example scalpels, dental wire, penetrate the protective outer layer of the skin. Insect bites, mosquitoes, deer ticks, fleas, and other insects such as parasites can spread disease as well. Food and water. There are many diseases such as E. coli or cholera that are spread by the ingestion of substances. All right, reporting the infectious agent. Combination codes. These code descriptions include both the condition and the specific pathogen. So examples: J02.0 streptococcal pharyngitis, and then we can see that we have a J09.X3 influenza due to identified novel influenza A virus with gastrointestinal manifestations. So here we see a code that has streptococcal, which is causing the pharyngitis. And here we have the influenza that is due to the novel influenza A virus, also presenting with gastrointestinal manifestations. Reporting the infectious agent, 2 codes are required. So when an infectious agent might be caused by any one of several different pathogens, you will need a second code to specify the bacterial or viral infectious agent. Often the code manual will alert you. This is where you begin in your index, and you look for your primary diagnosis code. When you go into the back into the tabular, you may see a use additional note like seen in this example. So here we have J85.0, gangrene and necrosis of lung, and it has under it a use additional code B95 through B97 to identify infectious agent. So this would be an example of a time when you're going to go back to your index, because if you notice, B95 through B97 is a range. You can have a ton of different codes in there. So rather than going in the tabular and hunting to find your code, go to the index, look for that infectious agent, and then let the index tell you where to go. Just make sure it's within that range of B95 to B97, and you should be good to go, as long as you're able to find that infectious agent. Bacterial infections. Types of bacteria. Bacteria are single-celled organisms named by their shape. Rod-shaped bacteria are called bacilli. Spiral-shaped organisms are called spirilla, and dot-shaped bacteria are known as cocci. Examples here: A05.4 foodborne Bacillus cereus intoxication, A27.9 leptospirosis unspecified. Then we have A49.1 streptococcal infection unspecified site. All right, examples of bacterial conditions include impetigo, foodborne illness, cellulitis, tetanus or lockjaw, and tuberculosis. Viral infections. Viruses are tiny microorganisms that embed themselves within their host cell and are difficult to isolate. They can remain dormant or latent for long periods of time. Examples of this would be influenza, hepatitis, and warts. Varicella is another one. Viral conditions. Viral warts, viral hepatitis type A, viral hepatitis type B, viral hepatitis type C, viral hepatitis type D, viral hepatitis type E, influenza, varicella, rubiola, rubella, herpes simplex virus, herpes zoster, and Zika virus infections. Parasitic and fungal infections. Parasitic infections. Parasites are tiny living things that can invade and feed off other living things like humans. One-celled organisms, called protozoa. Insects, such as lice and mites. Worms, such as helminths. Parasites can be transmitted in food. They can also be spread by mosquitoes and other insects through the bloodstream or through ingested contaminated water. Fungal infections. Fungi, which is the plural form of fungus. Mushrooms on your pizza or in your salad, and yeast in your bread or beer are tasty. Mold, a form of fungus, can be delicious when it is called blue cheese or feta cheese, and it can be helpful when developed in a pill containing penicillin. Fungi can cause illness such as aspergillus, lower respiratory tract dysfunction, Candida albicans, infection in the mouth and the vagina, onychomycosis, a common nail fungal infection. Infections caused by several pathogens. Pneumonia. Bacterial pneumonia, we have viral pneumonia, fungal pneumonia, and secondary pneumonia. Then we have meningitis. Bacterial meningitis examples include A39.0 meningococcal meningitis, A54.81 gonococcal meningitis, and G00.2 streptococcal meningitis. Viral meningitis include A87.0 enteroviral meningitis, A87.1 adenoviral meningitis, and B26.1 mumps meningitis. Immunodeficiency conditions. Human immunodeficiency virus. HIV testing. They could test negative. Tests can be inconclusive. Tests can be positive but asymptomatic. Tests can also be positive with symptoms or manifestations. HIV status with unrelated condition, and there's also a HIV status in obstetrics. Remember, if your patient is pregnant, then you're always going to need an obstetrics code. So always start in pregnancy when you're looking for a code for a diagnosis of a pregnant person. Check there first. Septicemia and other blood infections. Septicemia and sepsis. Septicemia is the presence of a microorganism or toxin in the bloodstream, a virus, a fungus, a bacterium, or other pathological substance. This also includes sepsis, severe sepsis, septic shock, and systemic inflammatory response syndrome, SIRS, without infection. Antimicrobial resistance. So, coding for AMR, there are several codes that are available to you to report antimicrobial resistance from code category Z16, resistance to antimicrobial drugs. Please note, the codes in this category are provided as use additional codes to identify the resistance and non-responsiveness of a condition to antimicrobial drugs. Code first the infection. So that infection should be your primary code, followed by your resistance code. Identifying the drug category. A physician's desk reference, PDR, or a drug guide can help you connect the name of a specific drug to a family name of drugs. Example, Z16.23, resistance to quinolones and fluoroquinolones. Quinolones are a family of synthetic broad-spectrum antibiotics. Ciprofloxacin, also known as Cipro, and levofloxacin, known as Levaquin, are a part of the quinolones family of drugs. AMR combination codes. Some infections are known to be caused by a patient's MRSA status. In these cases, ICD-10-CM provides a combination code that can be used one code instead of two different codes. Examples: A41.02, sepsis due to methicillin-resistant Staphylococcus aureus. J15.212, pneumonia due to methicillin-resistant Staphylococcus aureus. Chapter summary. The contagious nature of infectious diseases makes them very serious. The coding of such conditions and their treatment has statistical significance in addition to the importance of reimbursement. All right, everyone, that is all I have for you today. Please let me know if you have any questions along the way. I look forward to hearing from you. Have a good one. Bye.